Today, both monitoring windows closed at 0. So we're moving from who's still at risk to what this cluster actually taught us.
This is Hantavirus Watch. An infectious disease doc finally puts numbers on the transmission biology. A new drug screen drops for a different strain, and the crew's hygiene crowd gets a homework assignment. Stick around, hit follow, and you won't have to come looking for the next episode.
This one's from Infection Control Today.
A rare hantavirus outbreak linked to a South American cruise ship is drawing global attention, but experts say fears of a COVID-19-style pandemic are largely unsupported. Infectious disease physician Matthew Pullen, MD, discusses Andes-virus transmission, misinformation, cruise ship risks, and what healthcare professionals should really be watching for.
Matthew Pullen at Infection Control Today does the thing I've wanted on the record all month. He names the family. Sin Nombre and Andes are the two we've been hearing about, and they don't behave the same way.
And he says the COVID-style pandemic fear is, his word, largely unsupported, which is what I've been chewing on for a month, while everybody on social media spun this into the next 2020.
The detail that matters. Andes is the hantavirus that can go person to person. Pullen's point is that even there, people should picture much closer contact than airborne across a room spread.
Right, so when Pullen lays out the actual transmission, we're talking prolonged household-level contact, caring for someone sick, sharing a cabin. A buffet-line sneeze is the wrong mental model. That's the specific I can finally hand a listener.
Here's the scientific reports paper from Wanda Christ, Bartlomy Perebsky, Oscar Fernandez Capetillo, and Jonas Klingstrom. Today's scientific reports paper is a drug repurposing screen, and the target is Puumala Orthohantavirus, not Andes. That precision matters. Puumala is the European strain behind most hantavirus cases in Scandinavia, and it's far better studied than Andes.
Right, so the obvious listener question is, the people who got sick on the Hondius had Andes. Does anything in this screen actually help them?
Honestly, not directly. A compound that hits Puumala in a dish is a lead, not a treatment, and Andes is a different virus. The useful part is the research machinery. This genus is understudied, and screens like this give labs more tools.
So it's a parallel track, useful for the long game, doesn't touch today's patients. I just want a funder to read this and go, wait, where's the Andes version of this paper?
From Infection Control Today.
Why should infection preventionists pay attention to a rare hantavirus cruise outbreak? Because it underscores a critical reality. Pathogens do not follow expected patterns. This case highlights the need for system-wide vigilance, environmental hygiene, and preparedness in high-density travel settings.
Now that the quarantine windows are closed, Infection Control Today flips the Hondius story onto the infection preventionist desk. What should staff in a high-density travel setting actually do differently? That's genuinely new ground for us.
And it's the question I actually care about. What happens on the next ship leaving port right now? I want the pre-outbreak playbook, not just the after-action report.
They frame it as environmental hygiene and system-wide vigilance. Solid IP doctrine. But here's the tension. Andes spreads through close contact and rodent excreta, and a contaminated buffet rail doesn't line up with the main pathway. So which ship protocols actually map to this pathogen?
Right, that's my hang-up. 147 people aboard, 7 cases by May 4, 3 of them dead within 2 days of the first report. If the answer is deep clean the dining room, that doesn't touch how Andes actually moves. So tell me which hygiene step would have mattered, or admit some of this is generic preparedness boilerplate. Okay, so Andes virus can spread person to person, but what does that actually look like? Are we talking about someone sneezing at the buffet, or is it more like sleeping in the same bunk as someone who's really sick?
Much closer to the second one. Past outbreaks tie Andes virus human-to-human spread to close, prolonged contact. Think household-level intimacy rather than a quick hallway encounter. Researchers have found the virus in human saliva and respiratory samples, so breathing and shared air in tight spaces can matter. But it doesn't move with COVID-like efficiency. The strongest signal from earlier clusters is caregiving. Partners, family members, and medical workers spending extended time physically close to someone who was severely ill and carrying a high viral load. The go-to case study is the 2018 outbreak in Epuyén, Argentina, a small Patagonian town. It showed transmission chains concentrated almost entirely among people who lived with the sick or directly nursed them. And that context shapes the Hondius contact tracing now. Per reporting on the outbreak, authorities are prioritizing cabin mates, crew members who provided direct care, and close travel companions. People who shared enclosed, poorly ventilated spaces with confirmed cases over multiple days, instead of treating every one of the nearly 150 people aboard as the same level of risk.
So a passenger who sat near someone at dinner probably isn't in the high-risk tier. But what about crew members who clean cabins or help move sick passengers off the ship?
Yes, that's exactly the kind of exposure profile public health teams are flagging, because it combines physical proximity, possible contact with bodily fluids, and the enclosed ventilation of a ship environment. Several countries, including the Netherlands, Germany, Argentina, and others, have already ordered tracking and self-isolation for people considered at elevated risk from the Hondius cluster. If you were on this voyage and haven't heard from a health authority yet, the guidance is consistent. Don't just wait for symptoms to appear. Contact your local health department or a clinician, because early reporting is what makes containment work.
If Hantavirus Watch helps you keep up with fast-moving outbreak news, try Ebola Watch, a daily DRC and Uganda Ebola outbreak briefing, every weekday with case counts, border tracing, WHO vaccine news, and traveler guidance. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. So if one stuck with you, the links are there for a closer read. That's Hantavirus Watch for today. This is a Lantern podcast.